Okay, well, welcome everybody to yet another GW Center for Integrative Medicine Open Virtual House. Please stay muted if you're not an actual speaker. And as I said, we'll do the questions a little bit later. So I'm Dr. Mikhail Kogan, Medical Director. And today I'm going to be speaking very little, I hope, because we have a big panel of our practitioners who are here. Our center has been treating trauma, mental health illnesses for a very long time. As you can see, we have a lot of providers here. I will be mentioning them shortly. And that's just because we feel strongly that trauma-informed care and mental health is such a critical aspect of our national healthcare crisis. And because of that, I think it's essential that any integrative medicine center has a strong team that can provide this care. And that is the case with us. So with that, again, I'm a medical director at the clinic. I personally see a lot of patients too. I'm not going to talk about my process, how I do this. I think I'd rather just yield the floor right away to our two leaders for today's virtual house. And I'm going to spotlight them and let them get us going, which is Dr. Embrey, and who's our psychiatrist. And then where's Sally? Why can't I find there? And Sally Novak, who's our therapist. And I have to add her spotlight. Okay, there we go. So Misty and Sally, you guys take it away. I'll mute myself and I will keep an eye on the wait room for everybody. Let people in.
Yeah, thank you, Misha. So, Sally and I are going to talk about kind of our approaches to mental health, and then I think we're going to hand it off to some other practitioners who are going to talk about other integrative approaches. So I'm the integrative psychiatrist at GW. And Sally, do you want to introduce yourself as well?
Sure. I'm Sally, and I'm the integrative psychotherapist.
So I think the way we were planning to do this was I was going to present my slides first, and then Sally is going to present hers. So we'll just get started then. I guess I'll just share my slides here. I think I'll have to share my screen. Here we go. All right, can you all see this? All right, so I'm going to talk about homeopathy for mental health. It applies to general mental health concerns as well as trauma, and actually especially trauma, because trauma can often be treatment resistant and somewhat responsive to medications, more often responsive to therapy. But even with therapy, there can be a lot more work that needs to be done. So I think integrative approaches are very useful for trauma, but also mental health in general. Okay, so two approaches to mental health in general. We have the holistic approach, where we consider the connection of the mind and body and that system, the capacity of that system to heal itself. And then we also have the reductionistic approach, which is what we use in our conventional medical practices of prescribing medications, where the idea is the body has specific mechanisms that need individual support. So when we talk about integrative medicine, the question is always, which approach do we use? And the way I approach it is that both approaches are valid, both approaches are true. They have needs, various needs throughout someone's mental health needs. So what is the definition of integrative mental health? This quote is by Andrew Weil, and he describes the innate capacity for regulation and healing. So the system of integrative mental health relies heavily on that idea that the body-mind system has a capacity to heal itself. And it also views the mind and body as inseparable. So what happens to the mind also happens to the body. what happens to the body also happens to the mind. So why do we need this approach in mental health? As I mentioned before, there's a lot of treatment resistance, especially with trauma. You can also have pretty severe OCD that is unresponsive to conventional medical treatments and therapy. It can be partially responsive, but some people can still have a tremendous burden that goes unaddressed. There can also be intrusive thoughts that, are really difficult to manage. Emotional dysregulation is another one that often has a traumatic source and can be very difficult to treat with medications and therapy, although dialectical behavior therapy is very good for that in many cases, but also requires a very intensive commitment. Anger outbursts and suppressed anger are also very good examples of when medication sometimes isn't enough. And the personality disorders are also deeply embedded characterological traits that also respond very minimally to medications. And sometimes can be responsive to therapy, but only in a few cases. Therapy can be beneficial, but fully responsive is hard to achieve. So with medications and therapy, we've identified that the combination of medications and therapy can be more beneficial together than each one alone. And that also raises the question for me about, will the evidence eventually show that the addition of integrative approaches are better than meds and therapy alone? So adding integrative approaches, in a way that supports the medical and therapeutic model, and maybe even in some cases replaces it once symptoms are stable. So what is the role of the mind-body connection in mental health? There's a lot of evidence showing that there's this mind-body connection. There's a lot of evidence demonstrating that inflammation and mental illness are closely linked. You see elevated CRP and elevated inflammatory markers in conditions like depression, trauma, and you also see that childhood traumas are a very accurate predictor of chronic physical illness. The ACEs study is a good example of that showed that the number of chronic illnesses and the severity of chronic illnesses correlated with the number of childhood adverse experiences. And then there's a lot of evidence too that meditation, which is a mind-body practice, can reduce inflammation and inflammatory markers. This mind-body connection, even though we understand that it exists, it's also difficult to understand the mechanism of it. How does it operate? What is involved in this connection? So that's where I like to defer to ancient traditions, because even though scientifically we don't fully understand this connection, ancient traditions have been around and have demonstrated with clinical efficacy that something is there in addition to what we can see and measure, and can be used to stimulate a healing response. I'm going to talk about the homeopathic approach that also takes this idea of this mind-body connection. And so we'll go through that a little bit. So the idea is that in these ancient traditions, that illness is not just in the body and mind, it's also in this subtle energy body. And it must also be addressed in addition to the physical and mental illnesses. So in the current medical model, we utilize the biopsycho-socio-cultural paradigm that identifies that biological causes, psychological causes, social causes, and cultural causes can all contribute to illnesses of the mind and body. I think what our current medical paradigm isn't fully able to appreciate just yet is the energy piece, and that is where integrative medicine can come into play. And I think a large part of why we haven't embraced it quite yet is just, it's very difficult to measure. It's very difficult to comprehend. It doesn't fit into our current paradigm. So if we embrace it, then what do we do with the rest of the information that we have? So I think energy medicine is going to be something that is highly valuable in the future. And right now it's kind of ahead of its time, but I think it's taking off in terms of some evidence for it. So what is this energy body? I call it the subtle body in this presentation, but every tradition, every ancient medical tradition has a different idea of it. They have different names for it, different anatomical descriptions of it, different treatments. But I'm going to go through a couple of those. But regardless of each tradition's approach, the idea that there's one common thing between all of them, and that is this idea that it has this innate healing capacity, kind of like a subtle immune system, if you will. And I think this is what makes it so hard to comprehend, is that if it's this electromagnetic biofield, how do we measure it? It was only, in the turn of the Industrial Revolution that we started to acknowledge electromagnetism and understand what it is. So the other medical systems that kind of appreciate this electromagnetic field, some of them are listed here. So Chinese medicine calls it the acupuncture meridian system. Ayurvedic medicine calls it the aura, and it's composed of koshas. And maybe Jennifer, our Ayurvedic specialist, might be able to speak to that a little bit. Dr. Rioux, sorry. And in homeopathy, it's not an ancient medical system. It's only a little over a couple hundred years old, but it describes this energetic force as a vital force. Naturopathic medicine also has an appreciation for this. Chiropractic medicine, osteopathic medicine, when there are osteopathic or musculoskeletal manipulations, it can open up what is thought to be energy channels that can promote healing. Reiki is another one, and therapeutic touch is actually one that has been developed largely by the nursing community and has a lot of evidence for that as well. So the idea is that when this subtle immune system is stimulated, the healing pathways are activated. This system is thought to drive development, cellular migration, tissue differentiation and repair, coordination of physiological systems, homeostasis, and various bodily rhythms, among many other things. And there's actually some evidence that it exists. There's this phantom leaf effect, where if a leaf is amputated, Kirlian photography has been able to show the electromagnetic field around the leaf. So you can still see the whole leaf in its electromagnetic form. And the salamander experiment showed the electrical potential of a salamander, even in just a fertilized egg. So it showed an adult salamander in a fertilized egg. So just some examples of things that can stimulate curiosity about what this electromagnetic field is. And here's where we talk about homeopathy, because this is the form of integrative medicine that I like to use often for psychiatric treatment alongside other, conventional therapies. I find that it's very helpful, especially like I mentioned with the treatment-resistant cases, and can speed healing up in a way that therapy might take a very, very long time to do. So what is homeopathic medicine? Like I mentioned, it's a little over 200 years old, founded by Samuel.
Do you mind?
No.
Oh, I think someone's unmuted, maybe. But the idea that he discovered, he knew 7 different languages, and he was a physician, but he also translated medical text. And in the translation of medical text, he learned about other cultural medical systems, or other different cultures' medical systems, and discovered this idea that they had been discussing about like cures like. So in allopathic medicine, we treat the opposite of what the symptom is. We treat with a medication that provides the opposite force of what the symptom is. In homeopathic medicine, it's this like cures like. The idea is that was stimulated when he was reading these texts, but he also started developing some curiosity about the treatment of syphilis, for example, when syphilis back in the day was treated with mercury. And he was curious about mercury toxicity also having very similar symptoms that are similar to syphilis. He tested this hypothesis on himself using not mercury, but quinine, because quinine used to be, and actually still is, used to treat malaria. But he wanted to see if he would develop malaria symptoms just by trying quinine. And he did. He, as a healthy person, he took quinine and he developed malaria symptoms. He started diluting the doses because he was using some substances that were quite toxic. So he diluted them. And this kind of developed homeopathy, where he noticed that even though the doses were ultra dilute, they were still having a very profound therapeutic effect. And it was no longer toxic, but it had a therapeutic effect. And this is where we get into where he hypothesized about this vital force, kind of the subtle body that we've been talking about, mounting an adaptive response when stimulated by the ingestion of a homeopathic remedy. So the power in homeopathic remedies is not in any biochemical strength that they have, although there are some studies about nanoparticles being present in homeopathic remedies, but that, we'll table that discussion for another day. In homeopathic practice, the idea is that it's not really a material reaction that is occurring. It's when the body is presented with a homeopathic substance that is highly, highly diluted, even though the physical body might not be able to detect any chemical substance, the energetic body very well is able to detect something there. And because it's a similar substance, with the like cures like idea, it mounts a very specific and very adaptive response to that substance. So the strength isn't in the biochemical nature of these remedies, but in their specificity for the symptoms that are being treated. When there's no specificity, there might not be any response at all, other than maybe some mild symptoms that develop temporarily and then go away. When it's highly specific, there is an adaptive healing response that typically ameliorates many symptoms, mind, body alike. And so the way I use it in my practice for mental health is I use it in many ways. So I use it to augment, precede, follow, or even replace conventional medicines in some cases. What I've noticed, though, for mental health therapy is still very much needed because often homeopathic remedies, when they stimulate healing, they also stimulate the person's desire to resolve issues that might be long held. So therapy is very beneficial in that process. Stabilization is always the first goal. So I never want to take anyone's medications off until they have some stabilization of symptoms. And then if it's their desired goal or it's needed due to certain side effects, we might do so safely and slowly. And then down at the bottom here, I've just listed some common remedies for certain psychiatric conditions. There's many, many more beyond these. These are probably just some of the more common ones. And actually, you can buy these in Whole Foods or even on Amazon through a company called Boiron. I have no ties to Boiron, so but I do often utilize them. And that's it for my part of the presentation. Did anybody want to ask any questions?
I think let's hold the questions to the end.
Okay.
Just because this way I think we'll be able to budget our time a bit better. So I think let's just proceed with Sally's talk and then we'll give floor to the other providers.
Thank you for that, Misty. It was very informative. It's a pleasure to be here to talk about something that has been my passion and my pursuit for over a decade. I'm Sally Novak. I think everyone knows that by now. I'm the integrative psychotherapist here at CIM, and I hold a doctorate in Oriental medicine as well. I'm a licensed clinical social worker. I first began to focus on trauma in about 2008 while working in a substance use disorder clinic in the military community in Tennessee. In 2011, I was working for the DoD again, treating victims and perpetrators of abuse and substance use disorders in a special forces community overseas. And in 2014, my husband and I moved to Maryland, where I was able to focus almost entirely on treating trauma in a DoD behavioral health clinic. Early on in my work for the DoD, I began to feel that the largely talk-based modalities and protocols that the DoD were endorsing, they just weren't cutting it. And I devoted over a year to working on advanced trauma certification, looking at the work of such experts as Peter Levine, Bessel van der Kolk, and exploring somatic and expressive interventions. I have seen time and again in my practice that many of the behaviors that present in my trauma work previously, I would say prior to when trauma and being trauma-informed became a thing, they were deemed problematic. And to some degree, I would still say they're problematic, but self-harm, treatment resistance, substance misuse, I really believe that they are often forms of communication. This is not dissimilar from energy medicine that Misty talked about. And it's very interesting to notice when a patient is cutting, what meridians they're crossing from an TCM standpoint. Misty mentioned stabilization, and I will say that in my work, I also prioritize safety. If patients are locked in their trauma energetic and mindset, they may not be able to fully participate in therapy at all until we have established a sense of trust and safety in the treatment room. I also am the self-proclaimed master of curiosity, and I use curiosity a lot in my work because, to quote Lisa Ferrance, who was one of my mentors, it is the antidote to shame, and because each client is so very unique, energetically and otherwise. I frequently make use of expressive modalities and movement. It's not unlike me to have one of my clients from the Recode program stand up and dance with me at the beginning of a session. And I draw heavily from internal family systems work, and I use EMDR. I am excited also to be engaged with our ketamine program, as some research suggests that the addition of psychotherapy to ketamine treatment can help extend the duration of benefits. So I am happy to answer any questions that you guys have at the end. Sorry, no slides for me today. And I'll move on. I don't know who's next.
I don't think we need any particular order, so do you mind if I just call on folks and introduce them as we go while you guys stay? And what I'm going to do is I'm going to be adding people to the screen as an added spotlight. So I just added Yael. So Yael is our yoga, trauma-informed therapist, and psychedelic-assisted coach. So Yael, take a couple of minutes and talk to us about your practice and what you like doing.
Okay, thank you so much. Thanks so much to everybody. And I loved listening to Dr. Embrey or looking at what Dr. Embrey also had, because that's a really nice segue for some of what I do. I'm a yoga therapist. I'm a Reiki master teacher, and I was trained at GW Center for Integrative Medicine by Lou Ann Jacobs, who some of you might remember. I'm trained in the Resilient Heart, which is from HeartMath. I spent a year studying compassionate inquiry with Dr. Gabor Mate, and now doing more integration coaching, and also working on a new modality that is called tension and trauma release exercises, which I hope to be offering soon. The slide that Dr. Embrey talked about was the biopsychosocial cultural modality, and yoga therapy looks at that too, basically saying that we have very different dimensions. We're multidimensional, complex human beings. We have the physical body, the energetic body, the sort of psycho-intellectual body. Yoga therapy says, well, you know, thoughts and feelings kind of exist at the same place. Some of us will have a thought and then we'll have feelings from that. And some of us will feel something and then a narrative will ensue. And then there's sort of a deeper level, almost like the subconscious of beliefs. And then the bliss body, which is, I think about as when there's the opposite of trauma or chronic stress present in the body. And that's when we're in a place of sort of safety and connection to others. And that's really the goal of all the yoga practices. So I said trauma and chronic stress because those often will act in similar ways in the body. So whether you've had stress over a long time, or if there's been some sort of event that happened and how that gets stuck in, I believe, in the tissues. Dr. Osera always talks about the issues are in the tissues. I believe that they get kind of stuck in the fascia, and there's a big relationship between the fascia and the neuromuscular aspects of ourselves. So a lot of what I do is to focus on developing both kind of quick techniques to help people come back into center, and then more, medium and longer term work, which is really about developing different strategies. And everyone is different. So for some people, those strategies are going to be more physical. For some people, they might be more about cognitive reframing. For some people, I believe in my own healing from trauma, spiritual has been really important. So, and I think our values and how we want to be in the world really also needs to be taken in consideration. So that's how I work. And the modality is less important than what the intention is. And then we could sort of play with that. Some people really like the Reiki because it's gentle, hands-on, and I can teach you mindfulness techniques, or we can do some coaching while you're on the table. Some people need more of a pure physical way of sort of discharging and restoring. And for that, we can use different therapies as well. And for some people, I'm really happy to be working with Dr. Kogan and with Dr. Novak on the ketamine therapy, because I really see for a lot of people that also helps resolve trauma and grief. So thank you so much for having me.
Thank you, Yael, so much. I guess let's go to Catherine, and while Catherine's getting ready, yeah, I'll stay here for a sec. So yeah, regarding the ketamine, our program has picked up quite a bit. We're definitely going to get ready for MDMA, or the ecstasy, which is going to get federally approved in a few months, sometime later in the spring. I'm already looking for sources so that we can add that. It's probably, well, potentially is going to be a bit more gentle even, because MDMA doesn't have that strength of depth of the dissociation, so to speak. So we'll be covering that more. Thanks, Yael, so much. Well, Catherine, so Catherine is also a yoga therapist, also Reiki practitioner, and many other things. So Catherine, tell us about your practice.
Sure. So I did want to clarify, I don't do yoga therapy. I'm not there yet, but I do have a background in yoga and more trauma-informed approaches, as well as yin yoga. So touching on what Yael talked about, the fascia is really incredible for what the emotions and whatnot that are held there. But Reiki is really near and dear to my heart, and it is an energetic practice originally from Japan. As Yael mentioned, it can be hands-on. It can also be done from a distance, but the hands-on practice can feel really nice, so it can be a really gentle therapeutic touch for individuals. Reiki focuses on our physical body, it can work on our physical, emotional, mental, and spiritual body. So kind of all of these different areas of us that it encompasses. And we say that the energy flows where it needs to go. So while sometimes people might need something more on the physical level, other times it might show up more on something to do with their emotions, with maybe some things that are going on mentally, or also with their spirit. I will say most often people do feel some type of a physical relaxation. A lot of times people fall asleep during a session, but there can also be emotional calming, or emotions can come up to the surface, whether it's crying or anger and rage, or even joy and happiness. People can also feel stress relief. So a lot of times they'll come out of a session just saying, I feel really nice, right? Or other times things can really work on much more of a spiritual level. I will share, I used to volunteer at GW Hospital and did monthly sessions in the med psych unit. And it was really beautiful to see how impactful even a very short, like minute or two work session could have on patients on the med psych unit. A lot of them felt far more grounded from that work, from that session. And we also saw this with other patients throughout the hospital as well, no matter whether they had had some type of surgery, which, was more of like a trauma to the body, or if they had gone through more of a traumatic event, it really helped to calm and relax them. So thank you.
Thank you, Catherine, so much. And we'll have Jennifer go next and talk to us a little bit about her Ayurvedic practice. It's a whole system. We can spend many, many hours on it, but Jennifer, how do you integrate mental health and trauma into your practice?
Yeah, so I'm an Ayurvedic doctor, yoga therapist, botanical medicine expert, and then my training in mindfulness is trauma-oriented and trauma-centered. So those are the ways that, the lenses that I think through. And I think it's an important thing to understand that in Ayurvedic medicine, the etiology of disease begins first in the spiritual body, then funnels into the psycho-emotional body, and then into the physical body. So by the time we have a physical symptom, we've had a psycho-emotional imbalance, and prior to that, a spiritual imbalance. And in thinking about spirituality, we use a very basic sort of definition. Spirituality includes relationship to self, others, the environment, and our sense of meaning and purpose, our orientation towards the world. So trauma in that sense is always spiritual because it results from a rupture in one or more of those relationships, along with the disruption of a sense of meaning and purpose. And as Misty mentioned, the koshas, and I think Yael did too, the 5 koshas, that's part of the picture. But there are also marmas, which are somewhat commensurate with acupuncture points in Chinese medicine. There are 108 marmas, but they are oriented around 72,000 nadis, and nadis are similar to meridian points in Chinese medicine. So there's a very deep web of energy within the body, and there are also chakras and auras a little bit, not so much an Ayurvedic medicine term in traditional sense. But the basics of Ayurvedic medicine are 5-element theory. The 5 elements are air, space, fire, water, and earth. And we have an understanding of each individual's constitution. Their constitution represents a baseline of health for them. And then what we treat is always the imbalance. So how far away have you gotten away from your constitutional imbalance? And the doshas are referred to as Vata, Pitta, and Kapha, as some of you may know. And so through a variety of diagnostic processes, we assess the state of the doshas, and then the treatment is always individualized and always oriented around root cause. And that's very important because Ayurveda believes in bidirectional causality. Bidirectional causality means that as we treat one thing, we are also healing its relationship to a variety of other things. And so when we treat Vata, all Vata-oriented symptoms will recede simultaneously. So if a person has anxiety and insomnia, let's say, and forgetfulness, these are all Vata type symptoms. They will all recede simultaneously as we treat that particular dosha, and likewise for the others. And let's see, the other important thing about treating all layers, body, mind, and spirit, is that when we request behavior change, sometimes that's very difficult for the patient to acclimatize to because they have a physical symptom or a psycho-emotional symptom or even a spiritual symptom. So it's important to address all of those in order to create a foundation for the patient to engage with behavior change, which can mean dietary behavior change, lifestyle, it can mean other types of habits. But we've got to really create some level of health oftentimes before the patient can have clarity to engage in behavior change. And the last couple of things I'll say is just that we have a very powerful materia medica and also medical aromatherapy, which are consistent with Ayurvedic understandings of the 5 elements in the doshas. And they also work at all of those levels. And plant biochemistry, but also plant bioenergetics. Plants have kind of energetic identities, and that's part of what informs homeopathy. So all this is kind of available through Ayurvedic medicine.
Jennifer, thank you so much. Kind of perfect as we flow now. We're gonna hear a little bit from Angela about Chinese medicine and also somatic experience, which is one of the modalities that she's doing.
Hi, everybody. Can you hear me? So I've been practicing Chinese medicine. Acupuncture is my favorite modality at GW for many years. And several years ago, I took a training in somatic experiencing. So now I combine them in my practice, which just totally makes sense. Because even with acupuncture, I noticed how often I have to address, always basically, such complaints as anxiety, insomnia, mood changes, depression, and oftentimes, story leads to specific traumatic event or accumulation of stress. So it was just natural for me to discover somatic experiencing and studied, and it just very smoothly incorporates into my work now. So what is somatic experiencing? A lot of things have been already mentioned about connection of mind, body, and accessing trauma and chronic stress through the symptoms of the body and kind of uncovering the story, uncovering the key of the issue through the body. What's interesting, I noticed, like I didn't want to mention it, but now I would like to mention that in somatic experiencing, which was developed by Peter Levine, for decades, and there are other similar techniques now, similar approaches. What's interesting is that it spends a great deal understanding, exploring what happens in the autonomic nervous system. So yes, we can on one hand see that the imbalance begins with the spiritual realm, but also we can see it from a different point of view that we begin a crisis from lack of regulation of our nervous system, which can actually, begin in very early, stages of childhood, like we all know, ACEs. So in somatic experiencing, we really focus on that part, what happens with autonomic nervous system. And there's a variety of approaches how we do that, techniques, therapeutic interactions, and regulations. But the key word is regulation, which is want to enable through a very safe approach this inner innate ability of the body, which wants to regulate, but sometimes just doesn't know how. So in the beginning of co-regulation, so therapeutic interaction is very important in every modality, not just somatic experiencing. So when we work with the patient, first, of course, we want them, make them feel safe and learn how to feel safe in their body and in their emotions. So provide some resources, strengthen the resources, help them to ground. But then what we do is we look at certain ways the body behaves during the stress, and we help in a very, again, safe level with titration, with a very safe approach to look in those experience of nervous system when it cannot regulate. So we identify those moments when the system cannot regulate and take it in the small baby steps, sorry, and guide a person through those moments. So basically, deliberately, let's look at this difficulty together with all the tools and learn how to, so we can regulate that. The person can learn how to regulate that. So I just don't have enough time to go through any particulars of this approach, but it's somatic, so it looks what happens in the body, sensing. It involves touch often. That's why it's really great for bodyworks, but also a lot of psychotherapists incorporate that and one way or the other, include touch. So it's very important for learning to co-regulate. So anyway, that's probably what I want to say for now. But there's of course much more to the approach. Thank you.
Thank you, Angela, so much. And last, we'll have Cynthia and Nina talk about MBSR. And then after that, we'll transition to questions.
Thank you. I'm Cynthia Powell. I'm delighted to be here. My background is in education, organizational leadership, and learning. Primary focus at GW Center for Integrative Medicine is mindfulness and mindfulness-based stress reduction. And in addition, I'm an assistant professor at the University of North Texas Health Science Center. And now I want to hand it over to Nina so she can introduce herself.
Hi, everyone. It's great to be here. I'm Nina Paul, and I teach mindfulness and stress management at George Washington University, and at GWCIM, I'm teaching the 8-week MBSR course, and I also work as a mindfulness and health coach.
And I just want to share, that we all deal with stress on a daily basis, regardless of our age, our background, our experience. You may already be aware that it's been estimated that about 75 to 90% of all visits to primary care physicians are for stress-related issues. And stress is not just a feeling or a mental state. If we don't address stress, in particular distress, which is a negative form of stress, and it really can impact every aspect of our life. So one way to cope with stress is through mindfulness practices, and Nina and I are the MBSR, qualified MBSR instructors through GWCIM. And mindfulness, as you may already be aware, is all about being aware. When we're being actively mindful, we're noticing and paying attention to our thoughts, our feelings, our behaviors, our movements, as well as the effects that we're having on people around us. So mindfulness-based stress reduction, also referred to as MBSR, is a well-defined, systematic, patient-centered educational approach which uses relatively intensive training in mindfulness meditation as a core of the program to teach individuals how to perhaps take better care of themselves, as well as live healthier and more adaptive lives. And some of the benefits, research has shown, reducing stress, of course, but also decreased medical symptoms, improvement in self-care, greater ability to manage anxiety or depression, improvements in symptoms of burnout, as well as an improved sense of well-being. I also just want to share that the next course that I'll be teaching actually starts next Wednesday, February the 7th from 6:30 to 9 p.m. Eastern Standard Time. And please feel free to reach out to me if you have any questions or would like additional information. And now I hand it to Nina.
Thank you, Cynthia. Yeah, so I will also be teaching the MBSR program. My program will run in the springtime, starting on March 7th. And that will be listed on the website along with Cynthia's course. One thing I would like to add to the definition or what you will get out of the 8-week MBSR course is a quote I'd like to read to you. So if you give a man a fish and you feed him for a day, teach him to fish and you will feed him for life. So once you go through the 8-week MBSR program, you learn mindfulness practices, which can be very empowering and resilience producing for you, gives you a way to manage your stress yourself, and you start to see that you become more capable and empowered to manage your own stress. And in addition to the mindfulness practices, you will learn the science behind stress and stress resilience, acute stress, chronic stress, and as Cynthia mentioned, you'll also be introduced to a variety of mindfulness practices.
Well, thank you, Cynthia and Nina, so much. So what I'm going to do is I'm going to add spotlights to all of our practitioners now, if I can, or maybe I cannot. Oh, okay. And we'll start Q&A, and I will ask the first question, which is very difficult to answer. I acknowledge that. And you don't all have to respond. So, the COVID, the wars, we are constantly bombarded by not just an actual physical or psychological trauma, but by perception of seeing other people suffering. And I think that's a profound trauma trigger for a lot of us. It also, I'm kind of reflecting on some of my personal life story and how certain recent events of 2 wars in different parts of the world that somehow related to my past have re-triggered some of my trauma. And it's probably true to a lot of us. So how do you all seeing this in the context of a whole global society? Because pretty much we can say that everyone is traumatized as of lately, right? Especially with the whole country and the whole world going through the pandemic. Any particular resources you want to share? Anything you want to say? I know, again, we can spend an hour here. So we have a couple of minutes per question, so be brief. Oh, and before somebody goes, the COVID part we handle for those patients who have long COVID, we have a support group. So we kind of try to, at the very minimum, offer this persistence of team or community presence, if you will. And I think that's one approach that seems to help. And I know that also Sally is doing that for patients with cognitive decline, where there's also a lot of trauma-based and mental challenges, mental health challenges based in declining cognition. So.
This doesn't really have anything to do with my practice per se, but Thich Nhat Hanh is a Buddhist teacher, and he talks a lot about war and resolving the troubles of our world by looking inward and examining, not only our reaction to that, but also any contributions we might have. We all have anger, we all have aggression, we all have things, impulses that if we allow them to go, they could cause a lot of damage. So I'm a fan of that approach, certainly doing everything we can in the external world to make peace, but also when there's not much we can do, looking inward and seeing what we can do there.
Thank you, Dr. Embrey. Anybody else want to try to answer that?
Well, I think it's important to include the concept of biophilia, which is love of nature, because nature and the relationship between human beings and nature is so innately healing and so innately therapeutic. And, being divorced from nature can be traumatic in itself because it's the environment we were meant to exist in. So I think the pandemic was difficult for that in terms of isolation, although some people were more in nature during the pandemic. So, but it's an important piece that we didn't really discuss. And so many of us do practice nature-based therapies in one regard or another, be that plant medicine or something else. So I just wanted to make sure that was also mentioned.
It's a wonderful resource that I hope we all can utilize. Thank you so much.
I'll just say I love Dr. James Gordon will talk also about the need not just for trauma-informed care, but for all of us to co-create a trauma-informed society or a trauma-conscious society. In trauma, a lot of our normal capacities to connect are disrupted. And so anything I think that we can do to connect with other people, with nature, with your animal companions, can certainly, and to also to think about now, there's this whole concept of glimmers as being the opposite of triggers. So to every day try to notice what brings you joy and to see if you can create even a 1-minute practice in savoring it in any of our connections. So.
Yeah, thank you, Yael, for bringing Dr. Gordon. I'll put the full hour-long podcast with him that we did some months ago on this particular topic, especially with him talking about the wars where his Center for Mind-Body Medicine is going to assist. Well, thank you so much for this question. So there are some questions in the chat, and I'm going to start with one that's very specific to Angela. Selma is asking, what do you think of using, I'm curious what could make a person with PTSD or CPTSD diagnosis a good candidate for somatic experience as opposed to EMDR? It's a very specific question. I think from my experience, either therapy could be very beneficial, but I wonder what Angela will, how she will respond.
Be also a question for Sally,
Mhm.
right? Because she would know more about EMDR than me. I hear from my colleagues, because I've never, I've done EMDR a little bit as actually a client. I hear from my SE colleagues, and a lot of them use them together, that both are great. EMDR could be a little bit faster if it works. SE is slower and more gentle approach. So for some people, one works better than the other. And it's a little bit hard to say for me, but maybe Sally can comment how to know which one to try first. I don't know.
I do it very case by case, and I think they work beautifully together, like Angela said. I think that's sort of the pitfalls in EMDR. If you have someone, and they're not end all be alls, but if someone's very dissociative, they're not a really good candidate for EMDR. I've also had a slew of patients recently with aphantasia, inability to visualize, which makes EMDR super challenging. So certainly for those patients, I think I would refer them to Angela and SE, but I don't know. I would tend to speak to the patient and see sort of energetically which way they're pulled. I think with EMDR, yeah, it can move quickly, but also there may be a lot. It's a case by case, is what I would say. And I think I don't have a good answer other than try one, try the other.
It may also depend on the type of trauma, if it's a developmental trauma or something that happened in life later, right?
Yeah, I mean, their ability to recall it may be a factor. I don't know what you meant by that, Angela, but I can imagine that type of trauma might play in, yeah.
Salma, continuing the same line of question, can you guys take a look at this? Pre-narrative trauma, does that mean EMDR or SC might be better?
Pre-narrative means pre-verbal.
Salma, if it's easier, just unmute yourself and ask. I don't know if that's easier.
Thanks, sorry. So if the traumatic events started before either the patient is verbal or the patient has no narrative memory of the traumatic event, does that point more towards EMDR or somatic experiencing, or could both potentially work even if someone can't say, oh yeah, I remember when such and such happened?
I would say both can work. What I meant by, if it's developmental trauma in somatic experiencing, it's like a deeper training for working with developmental trauma, pre-verbal trauma, but definitely points to SE. And I could start working with that, but I think eventually I would like to do more training in that particular. It's difficult because it's so early, yeah. But SE would be able to work with that.
And I would not rule out EMDR either, because even if a person doesn't have a narrative, if they have some felt sense of what happened to them, we can access that. And then there's their language around that felt sense, if that makes sense.
What is really important, at least in SE paradigm, is we're working not with a memory. With a memory, but which is present in the body, not with a story that happened. Like some of the traumatic events we actually, we processed, and we don't, even if they happened, even if like the portion of trauma that still affects us, maybe not the whole thing. So in SE, we work with something that's makes itself present, and that means the person's body and soul is ready to work with that, given this safety provided. So whatever is available at the moment, that's how the work goes. So it's really not important that in SC, it's not important at all to remember any particular events, because it's autonomic nervous system response. If it gets kind of somehow processed and finalized, so to speak, energy is released, that could just close the case. I mean, it sounds kind of easy, but essentially that's how it could work.
Just to add on to that, I agree. That's my experience too, that what's happening in the present is often deeply connected to things that happened in the past. Sometimes even like ancestral past. You know, we talk about epigenetics and how ancestral trauma can manifest in the physical body. That doesn't mean that you have to have a memory of it. You can still address it energetically, you know, using somatic therapies, you know, things like that. So, yeah.
Thank you. There was a very interesting conceptual point and question. You know, homeopathy is like cures like, right? But if you look at the rest of biomedical model, we usually hammer out, like we use something against antibiotics to kill you. But there are some pockets, right? So the vaccines, in a way, kind of similar in certain aspects, and then also like some exposure therapies, like exposure for anxiety. Dr. Embrey, do you want to just talk a little bit about that, and just as a sort of the paradigm differences, and also like, you know, any other ideas on vaccines and exposure therapies?
Yeah, so exposure therapies are really the root of mental health treatment because a lot of, you know, I always tell patients we have two paths. We have a palliative path and a, you know, where we do coping skills and things like that, and you know, we cope with stressors. We even take medications. You know, we distract ourselves. We eat, we sleep, right? That's like kind of the avoidant, but it's also palliative, and it's very effective and it's very useful. But we also have the path of healing, which is a confrontational path where we have to expose ourselves to the thing that's very difficult to face. For people with trauma, that is very overwhelming. So I certainly think that both paths are valid. But the palliative path and the things of the opposite treatment is what we use as a detour ultimately to get to the healing path, which requires confrontation and exposure. And little by little, you know, with somatic experiencing and EMDR, you're really doing things little by little, not all at once, because that can overwhelm the system. So you definitely utilize the other path. But ultimately, exposure confrontation is you know, really going to have a profound effect. That's why exposure therapies work. And that's why vaccines work. That's why allergy treatments work. Is, you know, you're stimulating the body in a way to adapt in a very specific way to a very specific stressor. So that relies on the body's innate healing. So that's where it's more healing rather than palliative per se. But yeah, it's a very good kind of parallel with kind of vaccines and allergy treatment and exposure therapy. You know, that's why we have all these kinds of medicine. Allopathic is obviously helpful, and doing the opposite is obviously helpful. Homeopathic is also obviously helpful. And you know, even in therapy and mental health, we train people to use coping skills, and we train people to avoid, right? When they are having emotional dysregulation, we say it's okay to avoid, it's okay to step outside of the moment. But ultimately the goal is to take small moments here and there to face the things that are really challenging.
I just wanted to mention as well that there's been talk by the practitioners here about, you know, shame and how that usually shows up with people that have trauma. And it's also very much in line with people that are struggling with their own stress. Their inability to function because of stress and other things going on in their lives. So I think that the mindfulness practices that you learn, wherever you learn them, are also techniques that teach you how to be non-judgmental and kind to yourself and self-compassionate, which are antidotes to shame. So I did want to mention that. I think the shame resilience is, as Dr. Brene Brown mentions, is a huge healing component that comes out of all of these programs, including MBSR.
Thank you. Thank you, everybody. So let's see if we have a last question. We're right at the hour. I want to make sure we respect everybody's time. Thank everybody for coming. Maybe if there is a last burning question, we can address it. I do want to remind everybody this is recorded, so we will make sure this is posted on our YouTube channel. You can always come back to this later. And also we'll post the links to different things, including the MBSR, including other offerings in the description to the video. So, all right. Well, thank you, everybody. Enjoy upcoming weekend. It's supposed to be a good, nice weather. See you all soon.
Bye-bye.
Bye.
Bye.
Thank you, everybody.